Another one in the thinking errors of therapists, and this is maybe the most damaging of all. These are all potentially pretty damaging. Is the placebo effect, and what the placebo effect is, and we've recently measured it with our Feeling Great app. I think we measured it precisely for the first time, as far as I know. But it's if what it is if you think something is going to be helpful to you, it probably will be helpful to you, but it's not because the thing itself is helping you. It's because of your belief, and this screws up everybody's thinking. And the first thing I want to say is what is the placebo effect, and how does it differ from a real effect? A placebo effect does not differ from a real effect. It is a real effect. You can't tell if you're being helped. Say if you take an antidepressant medication, you can't tell, and you recover from, let's say, depression, you get better, your depression goes away in 5-6 weeks. You can't tell the difference if that's a placebo effect or a drug effect, because the outcome is exactly the same. But here's the problem. A good 1/3 of people who are moderately depressed or more will improve or recover, or whatever word you want to say, quite dramatically from a placebo. If they think the pill they're taking is an antidepressant, they'll have a pronounced antidepressant effect. Now, I myself am, they call me the human placebo. In other words, if you come to see me, you'll have the expectation that David is a master therapist, and I'll even tell you I'll probably just see you once for 2 hours, and we'll try to complete the course of therapy in 2 hours. And that's a placebo suggestion that I give people intentionally, that we're probably going to, cause your negative feelings to disappear in today's 2-hour therapy session. And in my experience, they nearly always do. But problem is that we can't tell the placebo effect from a real effect. Now, here's where people can start getting mad at me. But if you have something that you think really makes you feel happy and undepressed, you're wrong. It's a placebo effect. The thing you believe in really isn't doing anything chemically to help you. Now, the health food stores are filled with these things. St. John's wort and various herbs and vitamins that are touted to do all kinds of magical things, give you, erections that last for 18 hours and take 10 years add 10 years to your life expectancy, or make your depression disappear. And they're not having anything other than a placebo effect. There was a study of St. John's wort, which people were using in Europe for antidepressant effect. It's some kind of vegetable substance or something of this nature, and it has no effects. But to find out, the National Institute of Mental Health did a huge study of St. John's wort versus one of the popular antidepressants, and a placebo, which was just a sugar pill. And they put many hundreds of moderately to severely depressed patients through this protocol. And I believe it was carried out at several universities. I don't remember for sure, but I think it was a multi-university study involving 4 medical schools. And the way the data came out is the actual group that improved the most was the placebo group, and the St. John's wort and the antidepressant were about tied and not as good as the placebo, and the study showed that neither the antidepressant was one of the real popular ones. I can't remember off the top of my head which one. and the St. John's wort it was proof that it had no clinically meaningful antidepressant effects. They weren't even as good as placebo. Now, what the drug company did, they publicized the fact that the St. John's wort was worse than the placebo, because they thought, oh, so instead of buying this dumb St. John's wort, ask your doctor to prescribe the antidepressant or antidepressant. But they withheld the information from the public that their antidepressant was also no better than St. John's wort. But that's the placebo effect, and it condemns psychotherapists as well, because if you go to psychotherapists, they'll have this idea that their therapy is working in some specific way. Like Carl Rogers argued that empathy is the answer, and so that all healing comes from empathy. So if you're an empathy doctor and you fancy yourself as having good empathy skills, which, by the way, I'm sure you don't. If you use my empathy scale, you'll find out that your empathy skills probably suck. But that's neither here nor there. If your patients get better, you'll say it's because of your wonderful empathy, but it's not. It's due to the placebo effect. You've sold them on the idea. And if you go to an EMDR doctor, they'll sell you on the idea that if you've had some trauma and if you're anxious, what you need is EMDR, and that's jiggling your eyes like this while fantasizing your memory of that upsetting event. And that's kind of called eye movement desensitization, something like that, therapy, EMDR. I don't know what the R is, but it's the idea that this eye jiggling is some radical, new, wonderful thing. And but they're doing something there I call coupling. They're coupling a new procedure, eye jiggling or rapid eye movement, with an old, established, proven procedure, exposure, and then they're attributing the improvement to the eye jiggling rather than the exposure. And that's actually not the placebo effect, but that's just the misattributing causality. But the placebo effect is, anything the therapists tell you that we're going to do this and it's going to help your depression or your anxiety, that's the placebo effect. And you've got to be able to outperform that to have a real effect. I might have said this before, but at a workshop, I once said that if you can convince people that ear tugging like this will treat depression, and you can sell your patients on it, it helps the eustachian canal, which changes the pressure in the inner ear, which changes the pressure dynamics in the brain, and then that relieves depression. So you do this, 3 times in the morning, 3 times at lunch, and 3 times at dinner. Oh, I feel better now. And that would be the ear tugging approach. And I said, if you could convince people that was effective, it would be effective. And then you'd think you had this new breakthrough treatment. And a year later, a fellow came to my workshop and some other workshop in another city and said, "Oh, Dr. Burns, do you permit people to give out brochures at your workshops?" And I said, "Well, I think the sponsors of the workshop were kind of frown on that, but what brochures did you want to give out?" And he says, "Oh, I've discovered this new thing I read about on the internet called ear tugging, and it's so simple. You just do it 3 times a day, and your depression will disappear." And he had all these colorful brochures and things on the wonders of ear tugging. So I got a kick out of that. But most of things that are offered out there have very little other than a placebo effect. But the placebo effect is powerful, but it is very misleading and tricks us into believing things that really simply are not true. So that's about it on the placebo effect.